I became a health ambassador because I had myself been through supported housing. I had that perspective that I knew what it was like. It was a very negative experience for me. It did ultimately result in a positive in that I got my council flat, but there was very limited support kind of at all, to be honest, either during my stay or afterwards. I found myself in a bit of a mental decline after I then left the project because I didn't really know how to properly look after myself, to be honest. And so I think I wanted to give something back, try and improve the situation for, you know, young people in the situation I'd come through.
When we go and do the healthy conversation, the peer-led sessions, we start off with doing like a lot of ground rules and just making sure that they know why we're there, who we are and what we're here for. And then we go on, we do like a little icebreaker so that they kind of, you know, break into it, everyone feels comfortable. And then we move on to talk about 3 sections. So we talk about stress management, we talk about mental health, and we talk about food and mood. And with each section we do like little activities and suggest ways that we can better our mental health. And
we kind of work through an itinerary of kind of fun activities like board games, for instance, which kind of talk about various stats and statistics that people might not necessarily know about mental health.
We like to get people just to write down what stresses them out and to put them on a balloon or in a balloon. And they don't have to share it with anyone, it's all private, and what they can do is pop the balloon so it's sort of their sense of relieving stress. And we also talk about what they like to do to relieve stress, like going to the gym or listening to music, reading a book, cooking, and to actually see what people tell us it's really interesting with what they do, because then we can also pass it on to other people who may not know how to relieve stress.
You know, I'm at their age range and I'm going through what they're going through, and I think that's really helpful as well because I can always use my experiences to kind of help those people at the sessions. We
know ourselves best, you know, we've got that unique perspective that sometimes can be missed out on when it's sort of done by support workers or people with qualifications in kind of care and childcare and healthcare. And also I think we know, like, we have a more natural connection with people our own age, so people kind of listen, you know, it's probably a slightly better connection between the people.
I enjoy kind of, you know, making a change to people, like how they feel, you know, and kind of suggesting ways that they can feel better when they're feeling down, and, you know, just giving my ideas. I really enjoy that.
I've gained a lot from being a health ambassador insofar as I feel that I've given back to young people my age. I feel that I've helped people. I feel that I've really managed to engage with people, meet new people, and kind of expand my experience with working with presentations and that sort of thing, and being able to talk to a group of people about something that matters.
I've probably gained quite a few things. I've probably gained friends, I've probably gained insight, but the biggest thing is to be able to be kind of like a confident person in a more professional world.
This project has given me confidence, the ability to speak in large groups, develop my own working group sessions to become a volunteer.
Before I did stuff like this, I was kind of intimidated by like the idea of it, the idea of having to be sensible in a situation and stuff, but it's made me think actually I can do this, I am intelligent, I can go and I can talk to people.
What I feel I've gained from being a health ambassador is that I've realised now that people are willing to talk about mental health a lot more, even though sometimes it might need just a little bit of a push to show how important it is and to reduce the stigma.
I like the project to continue in Foyers and have health ambassadors that are involved if they want to kind of further carry on the journey and to spread out to as many people as they can and just keep it going.